questions?
No, I've been around too long.
What'd you say?
Been around too long already.
Okay.
I'll ask one.
Okay. Sean, you can always count on Sean.
Oh, Sean.
Okay, so since we're all in the same boat here, one of my most troublesome one is the GI-related diarrhea. And we've tried everything under the sun and something new recently. But this last cycle, I tried to eliminate gluten from my diet.
Okay.
And it seemed to make a pretty substantial difference. And just like I seem to have developed a lactose intolerance over the years of being on Symptom, so I avoid lactose products as much as possible. It may be a fluke, it may be the better weather or not, but have either of you come across any experience saying that gluten is
I haven't actually, and that's interesting. We often will tell patients to try to avoid the milk products, and I haven't heard that, but it wouldn't surprise me if that actually does help. Have you ever tried Dan Active, the yogurt drinks? Have you?
Yeah.
You tried those? Were those beneficial at all, or?
It's really hard to pinpoint exactly because every cycle's a little bit different.
Sure.
But yeah.
So how hard has it been to cut out the gluten?
It wasn't that hard, really.
No. Okay.
No.
Yeah, I don't know. Anyone else in the audience that's tried that?
Well, my children had to go gluten-free.
Okay.
And my children have had to go gluten-free. And we found an increasing number over the last year even, an increasing number of gluten-free products available in the stores. And I often go gluten-free just because it's easier to, keep everybody in the same diet. But even pastas and, tinkiata, which is a great pasta, brown rice. There are just a large number of products now, even desserts, which some people don't like, but
Eat dessert first. Thank you, Sean. I look forward to hearing if that continues to be helpful.
Who's next?
There are so many people in the audience who have been here, they could probably come up here to do this.
Okay, I'm glad we're not videotaping it this year, because
Yeah.
this would not be exciting video.
You want to talk about the hand foot skin reaction and the rashes, and sometimes they're really severe. The patient cannot type or cannot walk. What do you suggest?
Well, I think, we try, when we put patients on some of these agents that could potentially cause that, we try to do preventative management initially, suggesting that if patients use their hands a lot, or if they're walking a lot, that we try to not do a lot of activity all at once and spread it out through the day, and then to use some creams preventatively as well. But sometimes, despite our best efforts, patients still develop the hand-foot syndrome, which is the redness of the palms or the soles accompanied by pain, and often getting to the point of blisters. And unfortunately, that can progress even after you stop the Sutent or whatever agent you're using, continue to progress until there's been a period off the medication. And we recommend gel soles to patients at that point, wearing supportive shoes. Obviously, going barefoot is very painful. I'm sure many of you can tell me all these things. We will hold therapy until their pain and their blisters have essentially resolved. And some of the creams that we recommend, we have a little pile here of udder cream that we have used for patients. Also, bag balm cream has been helpful. I've heard that henna, we don't officially do henna, but henna treatments have been used by some patients and have been shown to be beneficial. Can you think of other?
Wear work gloves if you're
That's right,
using your hands.
right, thank you. At night, we often recommend putting on the cream and then covering.
No, I mean, if you're doing something physical with your
Okay.
hands, wear work
That's a
gloves.
good idea. And then at night, we'll suggest putting socks on over, over the creams, and same, I would say, for the hands if it's very severe in that area. Yes?
On the henna, I picked it up from my husband
Yeah.
at the doctor's advice, and he hesitates to use it because he thinks he's going to have red hands and red feet. And I'm wondering if, is that the case? Does it actually dye the hands and feet?
It will discolor them for a time period, but the patients that have had benefit seem to feel that it's very worth it.
Thank you.
I seem to recall putting some mint peppermint oil in with the bag balm or in the other solution, and it livened my feet. It made them feel so much nicer.
Great, good.
You need skateboard, Dr.
I need the exercise.
I'm on Votrient now, and
Yes.
hair loss seems to be a problem. Any suggestions?
Wow, this could be $1 million industry.
Well, let me tell you how bad I feel.
Dr. Choueiri is going to help us with that.
We could fund a lot of kidney cancer research if we could just lick that one.
It's true, it's true. I haven't had a lot of experience with putting patients on agents that will improve hair loss. Have you, Dr. McDermott?
No, I mean, I think the only thing to do is to switch treatments,
Yeah,
if that happens.
which is tough if this treatment is doing what you want it to and the side effects are tolerable.
Right. It's reversible, though, once you stop the drug, and not in Dr. Choueiri's case, though.
Right.
Hi, in regards to the hair loss, back in, it was 2007, I had dyed my hair and then I lost it because of the clinical treatment. And after that, I was pretty much bald with patchy spots. And then we started using the mane and tail shampoo. It's used for humans, but they basically advertise it for humans. Even my hairdresser says my hair is so thick now, she can't believe it.
Which one is it?
What is it?
Mane and tail.
So where do you get that?
CVS sells it, Walmart sells it, but Walmart you find it in the pet department. But it does say also on it for human consumption. My father-in-law years ago told me to use it. Before I ever lost my hair, because he's in the Navy. It says, yeah, it has a picture of a horse on it, but it does say you can use it for humans too.
No, I think that's fine. Dr. Choueiri was writing that down.
And I even had my hair trimmed yesterday. Put that
Yes.
on your list.
No, I think it's a good idea. Other questions?
This is for Dr. Seery. Tony, in your research and Bond, in your work, have you got any clues, any treatments that can ensure a winning season for the Red Sox?
They will win. They'll take it all this year. No Yankees fans are allowed here.
Okay, other questions? Okay, I think that's good.
Okay.
Thank you, guys.
So we actually do have some handouts, side effect management, if you would like these booklets. Come up and feel free to take creams, and also living with kidney cancer and clinical trial information, if anybody would like these booklets. Thank you.
So the next session, yeah.